1, 2. 1, 2.
I've already sanitized, so I'm going to get off my pep.
Here is that the temperature.
There was a need for such a training because these officers are getting in contact with so many people while executing their services in different places. And they may get that disease and transmit it to their families and even the other people, the people they are working with, and even those in our facilities. Yeah, by facilities I meant the vehicles they are using, because they are using the same vehicles. They are using firearms which are being exchanged from one person to the other, and there is always need to have those things disinfected before they go to a second person. So at least every day there is an exchange of firearm from one person to another. And the vehicles are just the same. We use them day and night. Officers changed the ships, but the vehicles remain.
All right. Since we started this exercise about 2 months ago, we have already targeted about, we've already trained about 1,900 police officers in about 10 counties in the country. And as of you know that we have about 75,000 police officers. And we are hoping and praying that we'll be able to reach out to all this. The only hindrance that we're having at the moment is, of course, I've said, we have few TOTs who are training and also the resources. So you're asking any partners who can come and partner with us as we go and try to reach all these 75,000 police officers. Why the police? It's because these are the police force or the police service are the team that is there in the front line. They're the ones who are dealing with, who are manning the roadblocks. They're the ones who are manning the isolation centers. They're the ones who are interacting with the suspects. And with that, they are technically more susceptible to this infection. So we thought and we planned and we discussed and we thank the DIG, Mr. Mbugua, for allowing us to come and train his people. This, whatever we are training them here is what they're going to implement out there. It's something that is going to help us as the citizens of this country as well as the police officers.
So what are you? Our concern today has been 100% trying to get the right information to the people, especially to the police. As you know, most of the people are actually saying that the police are creating stigmatization. The police are actually making people feel like the fight about corona is a fight about people being taken to quarantine and all these things. So with the risk information and all this risk communication that we've been able to be trained on how to pass that correct information to them, they are now understanding much better on how well they should protect themselves first. Because everybody has ever taken that the police are the people who are on the front line, but nobody has actually thought of going down to them and seeing how best they can be trained. We as the National Gun Owners Association, we've seen the best that we can give, because we can't fund them all, is we can pass to them the right information. And our plea to our membership has been that if we are within a certain area, if you live in Machakos, organize the people from Machakos, then we'll come and give the right information to the police. If you're in Kisumu and you're a member of the National Gun Owners Association, equally do the same. And our plea to the public also would be the same. How can we always say that we know our OCS, we know the closest chief within the area, but we don't come together to see how well we can support them? And at this time is the right time for us to go out, support the police, give them the kind of information that they need, give them the kind of resources that they need, so that by the time they're protecting people out there, they are first protected themselves. And that's the reason why we're here today.
So what is this?
Into 39 years old. That is actually the youth age, and that you'll find that that is the most active age today. And you'll find that these are the people who are most active. One, when they say stay at home, you'll not find them staying at home. Two, when you tell these people do not congregate or keep safe distance, you'll not find them keeping the safe distance. Three, you'll find that these are the people who you hear being referred to as the people who wear the masks purposely for the police. Because they don't want to be arrested, so they wear the mask. If they don't see the police, they remove their mask. If they see the police, they wear their masks. So these are the most active team. And to some point, we usually say they are defiant. And they are at an age group where they usually feel like they won't even know better. For lack of better words, I would just like to say that is the most active group of people, and where you find them with so many activities. They lack to follow what the government regulations are. And that is why you're finding that they're the ones who are most affected by this particular virus. And you'll also find that at the same time, they're the ones who are mostly asymptomatic. You'll find that they are shedding the virus a lot because nobody can tell. They don't look like they are sick. They don't have the signs which are there. And that gives them even a chance for them to be able to penetrate many other areas without being identified that they have this particular virus. That is why the numbers are high within those particular age groups.